The Flinders University International Centre for Point of Care Testing was launched in March 2011, and its establishment really represented the culmination of 15 years of pioneering practical work and leadership in the field of point of care testing, which first began at Flinders in 1996. Point of care testing enables pathology tests for chronic, acute and infectious diseases to be performed in a primary care setting outside the laboratory at the time of consultation with the patient, with the result being immediately available to make an informed clinical decision on patient care and management. Point of care testing is actually one of the fastest growing sectors of the pathology industry globally, and it's really useful in rural and remote clinical settings where disease burdens are very high but access to laboratory services are quite poor. The main activities of our International Centre are to translate our national research and teaching expertise in community-based point of care testing to an international audience, and to also build the capacity of rural and remote communities globally to develop and sustain their own innovative quality assured point of care solutions to try to improve health service delivery and patient outcomes in their communities. Our centre really specialises in managing point of care networks for diabetes, and these include the Australian-based QAMS program.
The QAMS program supports the use of quality assured point of care testing to assist the management of diabetes in Indigenous clients in Aboriginal medical services across Australia. 2 point of care pathology tests are used in the program. The first one is hemoglobin A1C, a blood marker for the control of diabetes, the long-term control of diabetes. The second test used is urine albumin-creatinine ratio, a marker for early kidney disease. The QAMS workshop is held annually. The primary focus of the workshop is to provide theoretical and also hands-on practical training in the use of the point of care device.
One of the cultural aspects of the QAMS program is ensuring that the leadership is done by the Aboriginal health worker within the Aboriginal and Community Controlled Health Organisation. It's just building that trust so that they feel comfortable with being able to share their health information with you.
Point of care testing has been accepted really well in the Northern Territory program.
The device that's being used in the Northern Territory is a point of care device that tests for acute and chronic tests. It can test for a whole range of pathology results, and those include electrolytes, blood gases, a cardiac marker, and also INR for blood clotting time.
Having the result there and then on the spot, and being able to engage in that dialogue with the patient on the day in regard to their management of diabetes and where we go to from here, whether there needs to be a change in their management plan, maybe a change in prescription. The difference that it makes in people's lives can be life-saving in some of these cases.
We've recently translated the successful elements of QAMS to a new international point of care testing model for diabetes management called ACE. And ACE is currently operating in 18 communities across 7 countries. ACE stands for Analytical and Clinical Excellence.
Collaborative partnerships have been fostered with international universities as well as professional organisations, and these are socially accountable but have also got strong links with their local communities who have high burden of diabetes.
In relation to our teaching, our centre's developed a graduate certificate in global point of care testing, and this is actually the first formal postgraduate academic qualification in point of care to be offered by any university in the world. Our International Centre is now recognised as a centre for excellence for research and teaching in the field of point of care testing internationally.
They received an award, an international recognised award up against 5 countries around the globe is just inspirational.